Imagine that you find someone unconscious. Would you know what to do? As a licensed vocational nurse certified in CPR, I'm going to teach you the steps to CPR today. In a medical emergency situation, there are 3 steps you should take. 1, assess the scene. 2, alert emergency medical services. And 3, start CPR. Once you find someone laying unconscious, the first thing you'll want to do is check and see if the person is alert. Are you okay? Are you okay? Be sure to speak in a tone loud enough so that they can hear you. 2, you'll want to go ahead and check for breathing on the patient. You're going to go ahead and lay them flat on their back. Open their airway. When listening for breathing, you should position yourself here. That way you can listen, feel, and look. You're listening to your breath coming from the victim. You're feeling the air if they are breathing, and you're looking to see if you see the chest rise. If you don't hear it breathing, you want to go ahead and feel for a pulse. You can do it here at the radial or at the carotid. If there's no pulse, you'll want to begin CPR immediately. On an adult, CPR, you'll use the heel of your hand. You'll form that this way or this way, whichever hand you're dominant with. With the heel of your hand, you'll place it between the nipple line, there at the sternum area, and begin your compression. On a towel, you'll use the 2 fingers. You'll also want to lock the elbow on either compression for an adult or a towel. The compression rate is 30 compressions for either adult or child to 2 rescue breaths. So we'll begin. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You'll go ahead and position the airway. Give 2 rescue breaths. Be sure to form a tight seal around the victim's mouth with yours. You can also do mouth to nose rescue breaths if you like. So, 1 breath, 2 breaths. And then you'll begin back at your compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you'll go ahead and position for 2 rescue breaths. You want to continue this cycle until a medical emergency services has arrived, or the victim becomes conscious and begins to make movement. There's a few things you want to remember when performing CPR. You want to make sure that you're doing 30 compressions to 2 rescue breaths, which totals out to 120 heartbeats per minute. That's 2 compressions about every second. Also, if you do have a child, you want to remember to use the 2 fingers instead of the heel for the adult. So, today I've given you the basic knowledge of how to perform CPR on an adult or a child. Now, if you do happen to find someone unconscious, you'll know the first step will be to assess your scene. Make sure you're out of danger. 2, contact emergency services. And 3, start CPR. You've now been given the basic knowledge of how to save a life. Thank you.